antioxidants relate to free radicals. Many of you may know that free radicals are chemicals that can produce injury to nerve cells and other cells in the body. Antioxidants could be beneficial in that they could help prevent injury to axons in MS. They could help prevent injury to myelin. There's some studies over the years indicating that free radical injury might be increased in MS. Over the years, over the past 15 to 20 years, there's been just a little thread of evidence of that free radicals might play a role in MS, but that thread really has not been followed through very substantially. There also are some theoretical reasons why antioxidants could be harmful. Some antioxidants actually activate some of the immune cells known as T cells and macrophages. So there's some theoretical risks, at least with some antioxidants. Next slide. So it's been exciting, especially in the last 1 to 2 years, that there have been multiple groups looking at antioxidants in a very organized way. So this sort of inconsistent thread of research over the years has become much more organized. So there have been multiple animal studies with green tea, grapeseed extract, multiple animal studies with alpha-lipoic acid and inosine. So multiple antioxidant studies in the animal model of MS, and those studies showing some beneficial effects. And then alpha-lipoic acid and inosine have actually gone on to some early human studies. So this is the most active that this area has ever been, and it actually has produced some promising results over the past 10 to 20 years. So I think we'll learn much more over the next 5 years with this increased activity of research. So I think both the antioxidant area and the polyunsaturated fatty acid area, I think those are both kind of unfinished stories in terms of disease-modifying unconventional therapies. Next slide. There are some unconventional therapies that could possibly affect the underlying disease and also affect symptoms. So that's an interesting combined potential beneficial effect. And that includes ginkgo, vitamin D, and calcium, and cannabis. Next slide. So in terms of ginkgo, this is a fascinating herb. It's just, I find it fascinating just to read about the herb and the clinical studies that have been done. There are 2 major chemical constituents in ginkgo. Flavonoids have antioxidant effects, like we've just been talking about. And then there are chemicals known as terpenes, and those are shown in the bottom left panel. Those end up having anti-inflammatory effects, which in theory could be beneficial for an inflammatory disease like MS. In terms of a possible disease-modifying effect, some studies have shown that ginkgo may be effective in the animal model of MS, but a fairly well-done study in Europe several years ago did not show that ginkgo was effective for MS attacks. In terms of ginkgo being effective for preventing MS attacks, that actually has never been studied. With regard to a symptomatic effect, there are actually 2 preliminary studies, but these have not yet been published. 2 preliminary studies indicate that ginkgo could be effective for MS-related cognitive difficulties. If ginkgo is used, it needs to be kept in mind that ginkgo can increase the risk of bleeding, and there have been case reports, individual reports where ginkgo might increase risk of seizures, so that needs to be kept in mind as well. Next slide. Another interesting area with regard to MS and disease-modifying as well as symptomatic effect is vitamin D and calcium. In the animal model of MS, known as EAE, vitamin D supplementation makes the animal model of MS less severe. To make the animals deficient in vitamin D, the disease is more severe. There was one preliminary study reported with a vitamin D related chemical in people with MS, and it did not show a beneficial effect. There was a study just reported out of the Mayo Clinic with the active form of vitamin D, showing that it was well tolerated in people with MS, but the study really was not designed to look at effectiveness. It was really more designed to look at safety. An area in terms of symptomatic effect with vitamin D and calcium is obviously bone density, and that's shown on the left panel there, you can see the decreased bone density with osteoporosis. And people with MS are probably at a much higher risk for decrease in bone density, and that's probably something that we as health professionals tend to under-recognize. So that's something that's very important to keep in mind. It's something that I really have just started to pay close attention to in the past 5 to 6 years. It's something we now have a very formal process to evaluate for in our clinic. And there are probably multiple factors that contribute to this, but certainly some people with MS have the same risk factors as those people who are at risk for developing osteoporosis, such as being female, not walking as much as you would otherwise, having decreased sunlight exposure, potentially having decreased lower than average body weight. So those are features of many people with MS and also risk factors for osteoporosis. Next slide. In the area of cannabis, this is a fascinating area, and it's really been amazing to watch the scientific developments in this area, especially in the past decade. It's actually been some remarkable parallels in terms of opiate research. So what's been recognized is that there are chemicals made within our body that have similar properties as the chemicals found in cannabis, and these chemicals act on proteins known as receptors. These are found on nerve cells known as neurons, and there are theoretical reasons why binding to these receptors could help with MS-related symptoms such as spasticity, pain, potentially other symptoms. And then there also are receptors known as CB2 receptors on immune cells, and in theory, binding to these receptors could suppress the immune system and could have disease-modifying effects in MS. There also are other effects that cannabis could have, and these effects include antioxidant effects, could decrease injury due to a process known as excitotoxicity. There's injury to nerve cells that can happen through a process known as calcium flux. So the multiple processes that are injurious to nerves that occur with MS, and cannabis in theory could be helpful for those. The big question is connecting theory with whether it truly does happen in the body. Next slide. And there have been small studies in the past, kind of anecdotal reports of beneficial effects with cannabis, and that's really been much of what's been reported in the literature in the past. Dr. John Zajac, Alan Thompson, and others in the United Kingdom really made some very important advances in the past few years by doing some very well-designed studies. So there was a study called the CAMS study, C-A-M-S, reported 2 different times for an initial study and then a follow-up study. This involved more than 600 people, and they had a placebo-treated group as well as a THC, and that's one of the cannabis chemicals, and then they also had cannabis extracts. So there are 3 different groups. And in the initial study, they followed people over 15 weeks. They didn't find any objective changes, but there were subjective changes that people noticed in terms of spasticity, also in terms of sleeping difficulties, and also pain. And then there was a 12-month follow-up study that was reported recently. And interestingly, in this study, the cannabis extract did not produce any significant changes. The THC itself produced some small effect on spasticity, and there was a suggestion that the THC may have slowed down the progression of disability. And then there's an oral spray form of 2 cannabis chemicals known as Sativex, and that has, in one study, reported to be beneficial for spasticity. This was not an ideal clinical study. It has been approved for use in Canada. And then fairly recently, there's a study known as CUPID, C-U-P-I-D, and that's I think that's one of the cutest clinical trial names that I've heard of recently. That stands for Cannabinoid Use in progressive inflammatory disease, and that's based in the United Kingdom. That's a 3-year study that's going to look at the effects of THC on people with progressive MS, and that's Dr. John Zajaczek is heading up that study. So that should be a large, multi-center, high-quality study. That'll be exciting to see the results of that. Next slide, please. And then the next area that I want to talk about are unconventional therapies that may have symptomatic effects, and this will include traditional Chinese medicine, Tai Chi, yoga, and hyperbaric oxygen. Next slide. So in terms of traditional Chinese medicine, there are multiple components of traditional Chinese medicine. With regard to acupuncture, there have been multiple surveys. We've done one large survey through our center. There have been several other surveys. In general, these surveys show that 20 to 25% of people with MS have tried acupuncture. In terms of formal clinical trials, the past studies in MS have been very small and really not conclusive. In other conditions, there's an indication that acupuncture may be helpful for pain, may be helpful for bladder difficulties, anxiety, spasticity. Acupuncture generally is very well tolerated, generally low risk. Another component of traditional Chinese medicine is Chinese herbal medicine. There's a very interesting herb known as thunder god vine that has some immune suppressing properties. It is effective in the animal model of MS. There's a very small study reported in the Chinese literature about using this herb in people with MS, but there's not any large human clinical study, and that really is needed to know if this herb is effective. Concern with Chinese herbal medicine is that there are some herbs that can potentially activate immune cells. These include Asian ginseng, astragalus. There's something called fuzang therapy. There's ephedra or ma huang, which can have toxic effects. There are other Chinese herbs that may have toxic effects on the kidney and liver. So I find this interesting and something helpful to share with my patients who have MS, who are using traditional Chinese medicine, that I think that acupuncture is something that's low risk and could be helpful for some MS-related symptoms, even though we don't have by any means perfect evidence at this time in terms of effectiveness. Often that acupuncture is combined with Chinese herbal medicine, which I think of as something where we really don't have any sense for the effectiveness of that therapy in MS, and there are some potential risks in terms of side effects of the Chinese herbal medicine potentially interacting with disease-modifying medications or interacting with the underlying disease itself. Next slide. The next area I want to talk about is Tai Chi, which is also a component of traditional Chinese medicine. There have been multiple studies in elderly indicating that it may increase walking steadiness. There have been a couple of studies in MS, one looking at Tai Chi itself, another one looking at what's known as mindfulness of movement. In those studies, it appears that Tai Chi may improve walking stability, may decrease muscle stiffness. In one of the studies, it appeared that Tai Chi may improve emotional functioning as well as fatigue. Importantly, these were not really formal clinical studies, so they were small. They didn't have control groups or placebo-treated groups, so further studies are needed. But this is once again, a low-risk therapy with some potential beneficial effects. Next slide. And then another therapy, kind of related therapy, or something that people often think of similarly to Tai Chi, or kind of in an exercise-type category, is yoga. And it's amazing how widely yoga is practiced, yet if you look through the literature, it really is very rarely studied. And it's important to keep in mind with yoga that the focus really is on the technique. It's not on doing extreme postures. And there are anecdotal reports of yoga producing beneficial effects with regard to fatigue, anxiety, muscle stiffness, pain. Certainly in terms of anecdotal reports, that's what I hear from my patients who practice regularly. So up until recently, we really didn't have much information at all in terms of how beneficial, whether yoga was beneficial for people with MS. Dr. Barry Oken at Oregon Health Sciences University did a very high-quality study recently, published it in the journal Neurology. This is a study of 69 people with MS. People were followed over 6 months. They were treated either with no treatment, conventional exercise, or yoga. And what he found was that either yoga or conventional exercise helped with MS-related fatigue, and he found that none of those interventions helped with cognitive difficulties or mood difficulties. Next slide. And then a therapy, I'm not sure if this is popular in Australia. It's kind of, there's been a resurgence of interest in this therapy in the United States, hyperbaric oxygen. This is a chamber that has a very high atmospheric pressure, increases the oxygen levels in the blood. There are some limited uses medically, such as for poor wound healing or decompression sickness. Like I said, in the United States, there's been a real increase in popularity over the past few years. In terms of MS studies, there were some studies done in the 1970s, early 80s, indicating that it was helpful in the animal model of MS, and then one human study indicating that it was helpful for people with MS, and that was published in a very prestigious New England Journal of Medicine in 1983. Unfortunately, there were multiple negative studies, and then there have been reviews of all the clinical trial studies, and those reviews have been quite negative as well. There have been some criticisms in terms of details of methodologies of these studies, but overall the results have been quite negative. So hyperbaric oxygen has been studied in multiple studies, and generally the results have been quite negative. Now at this point I could actually go on for another hour or two, and I could talk about all kinds of different therapies, and it is a quite fascinating topic. There are lots of different therapies that have been studied in relation to MS. There are some therapies that are of theoretical interest to MS, and often in terms of a talk that I do for professionals, I do cover many, many different therapies in terms of their relationship to MS. When I first got interested in this subject, that's the kind of talk that I would do for people who had MS. And what would happen after those talks, it always happened after those talks. There would always be a few people who would come up to me after the talk and they'd say, you know, that all was very interesting. You know, you covered 10 or 20 different types of therapies. But what would you suggest I do if I have an interest in using these therapies? Well, of all those things that are out there, what do you think I should use, especially if I'm interested in mixing these therapies with conventional therapies? How do I do that, and what would you think would be a reasonable way to do this? And that was a challenging question for me, and often when I first got interested in this subject, there was a lot of interest, and I would travel around and do talks, and people would pose this question, and it was a difficult question. I'd kind of get on the plane and travel back home and ponder the question on how do you put all of this together, and how do you mix conventional medicine and unconventional medicine. So I put lots of thought into it, kind of thought about it within the program we have, thought about it with, talked about it with patients that I have. So that's what I'm going to spend the rest of the program talking about. Next slide. And if we go back to this, like I said, this image that I wanted you to keep in your head of conventional versus unconventional, the black and white. So what if you're someone who wants to stay in that oval at the top, but then also dip down a little into the gray area? Next slide. And take away this strife between the conventional and unconventional. So what if you want to dip down into the gray zone, use things that are conventional, unconventional, you're willing to try things that maybe aren't 100% proven, but they're very unlikely to be harmful. What kind of treatment plan would that look like? something that integrates conventional and unconventional therapies. Next slide. So if you want to mix conventional and unconventional therapies, a few general precautions. One is to avoid a common error on the unconventional side, and you do not want to activate the immune system. There's some books on unconventional medicine that say you should be activating the immune system if you have MS, and we've actually reviewed those books, and that's an incorrect recommendation. Also good to be a psychologist, get a read on who's giving you information. There's some people on a real rebellion against basic science and against conventional medicine. If it feels like it's a rebellious person, I'd be suspicious. And then watch for telltale signs like testimonials or secret ingredients, or one therapy works for 200 diseases, or the therapy is very involved, like injections or intravenous therapy, or inpatient hospitalization is required. So those are just some general precautions. Next slide. So, like I say, I spent lots of time talking to other people, thinking myself, kind of thinking of everything I knew in terms of what conventional medicine, unconventional medicine had. And I think for me, I think we can put it broadly into 5 different steps. This kind of integrates conventional medicine and unconventional medicine, uses the best of both worlds, is kind of unbiased, really uses evidence that we have, is not prejudiced. And I think importantly, it's individualized. It's integrated, and it's also individualized, accounts for people's different personalities, people's different orientations. And also, as many of you may know, just looking around the room there, that MS has different effects on each person who has the disease, so you need to build that into a broad-based treatment plan. Next step, or next slide. So in terms of these 5 different steps, I'm just going to cover these broadly. The first step is, and like I said, we're going to jump back and forth between conventional medicine and unconventional medicine. We're kind of pulling from both sides, and we might simultaneously use things from conventional and unconventional medicine. So you can see the 5 steps there: disease medications, dietary approach, wellness approach, exercise, and symptom management. With the limited time we have today, we can't go through any of these in a lot of detail, but I thought I'd just try to convey a sense for what might be included in this type of approach. I'm very excited that we've just received a grant where we're able to provide a clinic where we're offering people education in terms of their own individual situation and how to integrate conventional medicine and unconventional medicine. We actually just started this type of approach this month within our clinic, and it really is primarily education-based. We're not specifically promoting any specific kind of unconventional therapy, but we're giving people education so they can make wise choices. Next slide. So the first step is disease-modifying medications. Next slide. And I think many of you are familiar with these therapies, and it's not the main focus of the program that I'm doing at this time, but there are the standard therapies with interferons. There's a non-interferon compound, glutaminyl acetate or Copaxone, and then there are newer agents, natalizumab or Tysabri, which in the United States, the FDA is currently reviewing that information, and then the chemotherapy approach that in the United States has been FDA approved, mitoxantrone or novantrone, and then lots and lots of therapies in clinical trials, including combination type therapies. Next slide. So like I say, I'm not the disease-modifying medications. We have the best evidence with those therapies in terms of trying to control the underlying disease process. So those are extremely important, but I'm not going to spend a lot of time because that's really not the focus of this talk. Step 2 is a dietary approach. And like I was talking about when I showed that table before, the table showed the positive evidence and the negative concerns, and that's why this area is so controversial and confusing. That's why there's so many opinions. I think the bottom line take is that a relatively high intake of these polyunsaturated fatty acids may decrease the disease severity over time, but it certainly is not definitive at this point. Next slide. So what I tell my patients is that as a neurologist, I don't think we have the definitive evidence at this point. I think more studies need to be done, and I believe that there's a study being done in Norway at this time, looking at a polyunsaturated fatty acid enriched diet, a more rigorous study than has been done previously. So I don't think, as a neurologist, we have definitive evidence, but if I was someone who had MS and I wanted to take a dietary approach, this is the kind of approach that I would take. What I've referred to it here, as a modified swank diet, and what's done in this dietary approach is to limit saturated fat, increase fish intake to 2 to 3 times per week, and then various supplements can be considered. The supplement that probably makes the most sense is fish oil. Also could be consideration to increasing omega-6 fatty acids. There are several ways that could be done. And then there's some supplements that probably should not be considered, which would include borage seed oil and black currant seed oil. Next slide. Important consideration is that if you're going to take this dietary approach, I would not do this instead of using the FDA-approved medications, the injectable type disease-modifying medications. I would, if you're going to do this approach, I'd do it in combination with those therapies. And importantly, if you increase polyunsaturated fatty acids, that can decrease vitamin E levels, so it's important to take a little extra vitamin E, but you don't need huge doses. Just 100 units daily is probably more than adequate. So that's, in brief, a dietary approach, this step 2. Next slide. And then the step 3 is a wellness approach. Next slide. And wellness, at least in the United States, that term, I almost hate to even use it, because in the United States that can be a fitness center or a gym, or it can be a website that's trying to sell dietary supplements. What I mean by it is a personalized approach, something that's optimistic, something that creates an empowered attitude, something that takes advantage of mind-body interaction potentially, something that might be able to use some of the power that we might see like with a mind-body interaction that we might see with a placebo effect. Next slide. And just in terms of placebo responses, this is some data. I just want you to focus on the top part of the slide there, the attack rates. You can see beta-seron, Avonex, Rebif, Copaxone, and the attack rates there before and after treatment. And you can see that's the attack rate per year. You can see, for example, beta-seron going from 1.8 to 1.3, Avonex 1.2 to 1.8, and so on. In general, it's a decrease of 15 to 40%, and this is just in the placebo-treated group. So that's before placebo and after placebo. Now, there's multiple possible explanations here. One is a statistical argument called regression to the mean. Also, the natural history of MS is that people tend to have fewer attacks over time, so this could reflect natural history. But this could also reflect a hopeful attitude that people have that a therapy is going to decrease the number of attacks they have, and somehow that hopeful attitude may produce some kind of mind-body response, and they indeed do have fewer attacks. So it would be nice that if there is a placebo response, that could be harnessed and that could be used on a daily basis by people who have MS. So that's part of what I'm talking about in terms of a wellness approach. So how to do that, that's a very individualized thing like I talked about. Next slide. So in terms of a wellness approach, if you're someone who's spiritual, then religion and prayer might be a way to do that. If you're someone who feels relaxed and empowered by exercising, then exercise might be a way to do that. Or if you want to mix spirituality and exercise, then yoga and Tai Chi could be a way to do that. If you're someone who feels empowered by when you actually are relaxing, then relaxation methods might be helpful. If you're someone who's a little suspicious of conventional medicine, but you still are using it, then using some kind of unconventional therapy could be helpful, such as traditional Chinese medicine or Ayurveda. Have someone think about your disease from a totally different perspective. If you have some kind of significant psychological issues, then good old-fashioned psychotherapy might be helpful. And then the whole area of this raises the whole question of placebos, and it's kind of interesting. My own patients know I have a strong interest in this area, and it's funny. quite a few of my patients come in begging me to treat them with placebos, but there are significant ethical issues to do that, at least at this time. Next slide. So we've covered those first 3 steps. Next slide. So the first 3 steps really are kind of pushing the limits, pushing as hard as we can to try to control the underlying disease process. Next slide. So we're using the disease